Well, good morning, everybody. Dr. Wickham Simonds here. Michelle Kennedy here, nurse practitioner. Thanks for watching the Dr. Simonds Metabolics and Weight Loss Facebook Live Ask Me Anything event. As usual, I'll start by saying we're open. I'll open our normal hours this week. I've always had a problem. People call this the AMA. I'm an ER doctor by training, and AMA means against medical advice. I've had a hard time. This is not the against medical advice show. This is good medical advice.
It is. Yes.
Ask Me Anything show. So, good news again. We've been giving away gift cards. We're going to give away a $25 gift card
again today, because we did it our
What do we
last
have to do
AMA.
to give away the gift card?
So
to get the gift card?
We ask for two things. We want you to like this video for us, and then we want you to comment in the comment section, #SimonsAMA. So like it and hashtag SimonsAMA. And also share it. That's not really part of it. But we like when people share these because they don't have to be watched live. It's recorded. All of the previous AMAs are on our website for you to watch at any time or share with friends.
That's exactly right.
Yes. So. And thank you for the questions. This is why we do these, because y'all send us such great questions to answer that you want to know about. And chances are, if you have that question, at least 10 other people do as well. So thank you for being the one to ask it so other people can get the information as well.
That's right. Okay. Well,
some good ones today.
Yes, we do. Yes, Carrie from Raleigh.
Yeah.
So
Miss Carrie says she's more than 80 pounds overweight and has type 2 diabetes. Will losing weight help reverse diabetes, or is it too late? I don't think it's ever too late.
Nope.
Never too late to achieve health.
That's right.
The extent to which you have the diabetes, how long you've had it, there are factors that we would have to consider, and that's part of our metabolic assessment that we do, and that's why we are medical providers that guide you on this journey. But I think with the weight loss, if we can't completely reverse it, which we typically can, honestly, we can put it into a state where it is so much better controlled. Your risk for complications are much, much better. You feel better. And then there's lots of other things that will happen when your weight goes down, your blood sugar improves, like your heart health will improve, and you will be at a lower risk for any kind of cardiac issues later in life, which is one of the main things the main thing really that affects individuals.
You wouldn't know it by watching the news. It's still the #1 killer.
Right. Heart disease is very, very
dangerous. It's been doing its job for the last 50 years. About 60,000 or so folks a month, 55, 60,000 people a month are dying from heart disease in this country.
Yeah.
And it's been steadily like that. So
women especially. So we really have to keep in mind this is not gender-based. It's not even age-based. We have people in their 30s and 40s experiencing severe cardiac issues and unfortunately dying from heart disease. And diabetes is one of the main causes of these heart conditions. So to tie it back, Carrie, I think the chances that we could reverse it or at least put it into an extremely well-controlled state is very high because we've done it and we continue to do it.
That's correct. We do. And look, if I started giving examples of the number of people who had diabetes when they came to see us and were able to get off all of their medicine and control their blood sugars and hemoglobin A1C, we would be here for the next 3 weeks live telling you stories. This is a very common thing. The way out of type 2 diabetes is restricting carbohydrate intake and losing weight. It's the name of the game. And now, there's kind of a more esoteric argument amongst physicians. And I'm just going to say this, for most of you, you can tune it out. But if you're really into this kind of stuff, your pancreas makes insulin. And it makes insulin from these little cells in there called beta islet cells. And the idea being, Michelle, you mentioned it depends on how long have you had it, to what extent. You can burn these cells out. You can get to the point where you don't make any insulin at all. And so there's one school of physicians who says, at that point, you'll always have diabetes and you'll have to be on insulin because you can make no insulin. Okay. There's another school, and I run into these all the time, And you have to be careful telling those people that they're burnt out and that there's no more insulin function there, because they will tell you that those doctors will tell you, no, I've got patients who went on a strict ketogenic diet, stayed on it, and regained this function, and that the pancreatic beta islet cells do repair themselves and begin to make insulin again. And so they'll cite to you many patient cases like that. So I would say that the one mistake you can make is not doing anything about the weight and the diabetes.
Absolutely.
And the dietary intervention is going to be the most powerful thing.
Yeah. And we really specialize in that here. Mentioned a ketogenic diet. I know if you watched these before, you know that we are advocates and educators of the ketogenic diet, and there are many, many reasons. But even if a ketogenic diet is not something you are open to, or you have concerns related to it, talk to us. There are other eating plans. There's simply lower carb. There's Mediterranean eating plans. There's other ways we could do it, but quite frankly, the most therapeutic way to lower blood sugar safely and effectively is through a restricted carbohydrate diet. So that is primarily what we teach here, even though there are other options absolutely available. Thank you if you just joined us. This is the Monday morning Simonds Facebook Live. We are giving away a $25 gift card, and we have 3 people who have already entered. Thank you, Susie, Bobby, and Annette. Thank you so much. Anyone else?
You got a 1 in 3 chance winning.
Charlie just came in.
Charlie's in. You're down to 25% chance of winning. That's still pretty good odds, though.
Very
1 in 4. Didn't cost anything to get in except just liking us some hashtag, right?
So thank you so much for watching. Share this, like us, and hashtag Simonds AMA in order to enter for the $25 Target gift card that we're giving away live today. Yeah. So that was a great question, Carrie. Thank you so much. Give us a call, either office. We are open normal hours, and we do phone appointments as well. So your first one will have you come in if you're not currently a patient, but keep in mind we still do have that option to make it convenient for folks.
Yeah, that's exactly right.
Yeah. So Chantel, you want to take Chantel's question?
Yeah, she says, my sister came to you guys before she moved out of town, had a lot of success. Do we still offer no contracts? We've never made anyone sign a contract. We're never going to make anybody sign a contract. Hey, when you go to your family doctor to get your blood pressure treated, do you sign a contract to do that?
It's not really the medical model.
Yeah. So signing contracts is some other kind of model. It's not our model.
Yeah. And Chantel, even though your sister has moved out of town, I just mentioned the option for the phone visit. We have patients all the time who they themselves are established patients, but then they move and they remain patients. Or I actually have a lot of patients, I'm sure you do too, where they say, I love coming here so much. I get so much out of it. My sister's visiting from Chicago and she wants to be a patient of yours. Can she establish when she visits me, once or twice a year, because they're coming to visit family, can she just see you in the office every time she comes to visit me, but then in between do phone visits? And we say, yes, absolutely. We know that there are wonderful practices like ours out there, right? It's not a competition. We say all the time, this is not a competition. We want people to find where they're comfortable and they can get the help wherever that may be. But if you live in a location where you do not have that accessible, come to us. Establish in person as an initial patient. We will see you at least annually after that in the office, but everything in between can be done remotely.
Yeah, that is correct. That's absolutely correct. All right, Tim from Durham. My wife and I are looking for help with weight loss. Is it better to come separately or together? That's kind of a complex question. Depends on the marriage, right? Depends on the relationship.
I will say most of our couples do come together. Not just couples. It'll be maybe siblings or mother-daughter, right? There are a lot of reasons that we find it is more beneficial to come together and to do it together. And really the support is the main thing, right? Then there's just the understanding of what is required to have this kind of lifestyle change, to have success. The accountability piece is there as well. And I can't tell you how many times people you're sitting together in my office and one says, don't forget to tell them about what happened and what you're struggling with. And it's good because they may not be comfortable saying, I'm really having a hard time with this, but their support person with them in the office will say, we really need to have this discussion because I know they're struggling and I know they need help. And it's just a great dynamic to have folks who are able to and willing to be seen together and do this as a joint effort, because we generally work better in teams anyway, right? As humans, we're pack animals, essentially. We shouldn't be expecting ourselves to do anything completely alone. So
yeah, well, thanks if you just joined us. We've got more people signing up for the free gift card. Cassandra, Jill, Bobby, and Ash. All right. Got some competition for the gift. Yes,
oh my goodness.
Competition for the gift card. Thanks for doing that and participating. We really appreciate it. And that's great. So, yeah, I mean, there's kind of an old saying that I think that maybe originates in the Bible, but the principle's true, is that, you would think that if you had one person, you have a second person join in, you got twice the effort, it's twice as good. But really, adding that second person, you get 10 times the result.
So it's exponential.
It's exponential, absolutely. Right? So the accountability that happens, and then, because look, if it's pretty easy when you're doing something by yourself, diet by yourself to cheat. You talk to yourself. I had an old pastor when I was a resident doctor, and he would always say, "Wickham, the measure of a Christian is what he does in private, when no one else is around." And when you're all doing this stuff all alone, it's easy to eat some stuff and drink some stuff you shouldn't be doing. No one's watching.
Right.
Okay.
Right.
But if your spouse is right there, now you got to pull the deed off in front of them, and you don't want to do that, and they don't want to do it in front of you. So this accountability starts to take place. And it builds on itself, and then you see the results you get, and then you're like, "Oh, I think I really like this." It becomes a very positive experience. So, I think that now if you got the kind of relationship where, I see this sometimes. For example, one spouse is mad about the other spouse's seeming success in comparison to theirs. Right, one's losing faster than the other one, it upsets the other. If you're gonna, or one doesn't like to weigh in front of the other one. I mean, it's not unusual to have a man who doesn't want his wife to see his weight. That's what you know what I'm saying? Just saying. So.
No judgment.
Right. So, so maybe you want to do that stuff. Maybe you want to come to the office separate, although you're dieting together. So we understand those sorts of things, and we don't want it to be a source of contention.
Exactly. Right. Yeah. So there are reasons why being seen separately. So even though you're both coming, being physically seen at separate appointments may be best for you. And that's okay. We can accommodate that. We don't require you to be seen together. We just see that the appointments typically go a little bit more smoothly in situations where maybe there's not animosity or some issues going on there. And oftentimes there's a little therapy session that happens in the office, right? Yeah. There's a lot that can happen when we're doing therapeutic management of weight and health and the emotional piece, the mental piece, and that's huge. That's huge. So having someone who's in your day-to-day life to help us understand that, because we only see you, for a short amount of time every so often, but someone who knows like the intimacies of your schedule and your life and your needs, having them present as an advocate for you as well can be really just a wonderful thing to take advantage of. I feel like I'm a little broken record with the phone thing, but I'm going to bring it up again. I have a lot of patients who they cannot both physically make it work with their schedules. They want to have appointments together, but only one can come in, and maybe we'll call the other one or we'll FaceTime. I actually FaceTime my patients through the patient who's here. They'll call their spouse or their sister or their mom and, say, I couldn't make it to the office, but I really wanted to do the visit together. And we have a virtual visit, with one present and one virtual, and it works absolutely beautifully. Yeah. So again, convenience-wise, we are here to really take whatever burdens off we can as far as getting you in and getting you the help that you need. So thank you for that question. All right, let's move on to Jean.
It's a good question.
Jean is from Durham and says, I'm an avid runner doing 6 miles a day. impressive.
Mm-hmm.
I could stand to lose maybe 20 pounds. How do I keep energy for long runs while trying to diet?
Mm-hmm.
And this is a challenge for
Mm-hmm.
folks who are doing longer cardio sessions. The point I will make is it is remarkable just to point out that you can never judge someone looking at them how fit they are. Okay, I have patients all the time comment, "Oh, you'd never think my blood pressure would be good, or you would never think that I go to the gym 6 times a week." And I say, "Why not? Like you can't tell." So I think that's awesome that you're running. It does seem like you have some extra weight that maybe you want to get off, maybe that'll help you feel better and improve health. So for energy, we have a lot of folks who do weightlifting and cardiovascular events that are fine with restricting calories, carbohydrate. We do so carefully, and we just maybe time certain foods or energy sources around the exercise. But I think it's a myth to say that your energy would be zapped if you were dieting correctly, right? Or cutting out enough things that you have no energy, that's the only way you're going to achieve your weight goal. I think you can continue to be able to run and live, a healthy, fit lifestyle while cutting back on your diet in order to lose that weight.
Yeah, I think that's right. And, here's the other thing. I mean, there's above the forest, 20,000 foot view down at the forest. Fat is stored energy.
Yes, it is.
Now,
we all have that.
If you're running 6 miles at a time, you need to be able to tap into that.
Mm-hmm.
That's a storage depot that you need to be able to tap into. I think one of the great disservices that was done to mankind happened. I don't know what your age is, Gene, okay? But I'm in my 50s. And I know I came along in the 1980s, and really this idea still persists to this day, but it was really big back then that you had to carb up for these runs. Mm-hmm. This is where you got the energy from. And this is a major conceptual error, okay? Your body doesn't need pancakes and cookies and pasta and all this stuff for your runs. It doesn't need all that stuff, okay? You need to train your body to burn your fat, because you can only store so much of that stuff as sugar anyhow. Mm-hmm. And it'll be exhausted in the first 30 minutes or so of your run. Mm-hmm. You need to train your body to burn fat. And that means you got to restrict these sources of quickly digesting carbohydrates and get your body adapted to burning fat as the primary energy source. This is the way our ancestors were. They didn't have a bunch of carbohydrate to eat or refined carbohydrate to eat before they took on their very strenuous lifestyles, okay? They were eating animals, what comes from animals and what they grew, all right? And this worked, mm-hmm. all right? Their body fats were a lot lower than ours, by the way. So anyway, we can teach you that stuff here, mm-hmm. and you can lose that. I think it's more important, not just your weight, but hey, how do I lose this body fat? Mm-hmm. Yeah. If that 20 pounds is from excess body fat, we need to deal with it.
Yeah. So Gene, give us a call. We can definitely guide you on that journey of continuing to run and wanting to lose some weight. Looks like we have a question in our comment section from Holly. She's saying she's lost over 50 pounds doing low carb keto, but she's plateaued for a while. She's maintaining, but how do I get past this plateau, right? And that's a very good question. We see this a lot, right? Plateaus are a completely normal, expected part of the weight loss journey, as is weight regain. But it doesn't mean we give up, right? There are strategies that we can use. Oftentimes we will change something, right? So if you're doing what was working, and congratulations, 50 pounds is amazing weight loss. That's so wonderful. But now you're just maintaining the 50 pounds, even though you want to lose more than 50. It clearly means that even though what you're doing was working, it just no longer is. It's not wrong. It's just no longer effective for weight loss. It's very effective for weight maintenance if you've been maintaining that weight loss for a while, but something will need to shift. Maybe it's a shift in timing of food. Maybe it's the macronutrients, the carbohydrates versus the protein. Are you getting enough protein? Are your carbohydrates low enough based on what you're trying to do with your plan? Are you eating too many snacks in between. There's lots of things with the diet that we can tweak: the timing, the quantity, the quality. And then maybe there's a need for a medication adjustment, right? So we use medications because obesity is a disease, right? It is a hormonal, biologic change that happens. And as you lose weight, those changes fight you, right? These biologic adaptations want, as your weight goes down, to push you back up, right? Or at the very least, keep you from continuing to go down. And that's what you're experiencing, Holly, is this kind of hard stop where you've lost and you want to go down, but it's kind of just pushing just enough to keep you where you are. And medication is a wonderful way to get that plateau broken. So if you're already on it, we may change something, we may add something. If you're not on it, this may be a really great opportunity to trial using some safe and effective medication that we prescribe every day here at Dr. Simonds Weight Loss. So I would say give us a call. If you haven't been seen in a little while, maybe if you have, give us a call. Let us help you and strategize. So what would you say, other than the diet changes,
plateaus are a part of the deal. Your body's going to try to keep you from losing weight. It's adapted to what you're doing. You got to do something different.
Yeah. And sometimes those changes too, I mentioned that. Sometimes it is a change in physical activity, a change in sleep, change in just the way we manage stress. Some people, they really find that a lot of stress in their life, which 2020 has been kind of a ball of stress for most people, that alone, even if they didn't change anything, they're still doing really good in their dietary plan and they're exercising, that alone will be kind of a hard stop for the body. So there's lots of different angles we can come at this from to try to strategize what would get you through that plateau, continuing to lose. So thank you, Holly, for that question.
Yes, indeed.
All right.
Okay.
Jordan. All right, Jordan from Raleigh. He has gained weight while his wife was pregnant. Not uncommon, I'll say that. Would like help. Don't want wife to feel bad if she can't join me. How soon can she start the program? And I think we've touched on this before. It's a good thing to keep revisiting. Mm-hmm. The strategy that we have, which is the safest way to do it, is we don't start medications until the period of breastfeeding is done. Okay, that doesn't mean that we can't guide on dietary changes and offer support for a healthy lifestyle during the nursing period, but prescription medications will not be prescribed while there is still nursing going on. But that doesn't mean
she's not nursing. If she's not nursing,
exactly.
She can do it.
She's not nursing, that's it. So if the pregnancy, has completed, if the baby has been born and there is no nursing that is happening, no pumping that is happening, that's fine. Come on in. You both can start at this point. But if it is the case that she still has a little while, come back, Jordan. Let us, help you now get some of your baby weight off, and then that can hopefully, help her too, because you're going to be in this healthy place. And a lot of times people get healthier around our patients by association, right? Yes. They're seeing and experiencing the success and the focus and the motivation, determination to do well, and that can almost rub off on them. So the whole household may become healthier just by one person coming.
Yeah. Brandy says, I recommended scorched earth a couple of years ago and she hit a plateau. That's right. Sometimes you have to do a scorched earth for a short period of time to break the plateau. Scorched earth means just something really kind of radical,
mm-hmm.
just really buckling down on your diet until you force your body to start losing again. Once it goes through the plateau, then you keep losing till you hit another one.
Mm-hmm.
Your body will hit them along the way. It's got
Mm-hmm.
these memorized set points where it does this.
Mm-hmm. And ultimately, weight maintenance is just a really long plateau.
That's really
so our goal
Yeah.
is a plateau in the end. I think the struggle becomes the expectations that we all have, with what we think we should be, or what we want to be, or what we used to be, and what our body is willing to participate in to let us be. And that's something we deal with every day here, is trying to help educate people and support people on appropriate expectations and why this is hard and why maybe they've had to do it 10 or 20 times before. And it's not a weak will. And it's not that you haven't tried hard enough or long enough. It's because you really are fighting the biology of your body that wants to keep you at that higher weight. And this is hard. This is really hard. And that's why we're here. I recently, and you did too, attended a conference by the Obesity Medicine Association. It was a virtual conference, and it was fantastic. It was full of lectures explaining why we struggle so much with these body weight changes. And we talked about the set points that Dr. Simonds just mentioned, and how there are certain weights that our body remembers that we've been throughout life, that it wants to kind of hold on to and says, okay, this is familiar, this is comfortable, I want to stop here. And so Holly, for you, I would wonder, or Brandy, for you, when you hit that weight that you struggled at, was that a familiar weight? Was that a weight you had been at previously for a period of time that you almost feel like, oh yeah, my body remembers what it was like to be here? So it's important to, I think, keep that in mind, and it's important for us to keep educating you all, and for you all to educate others, and for us to try to educate the greater medical community that this is worth medical treatment and lifelong treatment. So we offer that here. We're in Raleigh right now, which is on Falls of Noose Road, right down from 540, next to Piper's Tavern. Nice, convenient North Raleigh location. And then the Durham location, the streets of South Point, right near Ulta and REI, across from the mall up there in Durham. And we try to have convenient hours so that you could call us to get an appointment in the evenings. We have some really early morning hours on Thursday in our offices. And again, we have the phone option. And we also have a pharmacy on site. You can pick up your medication right here. We don't have to send you out and about. It's kind of a one-stop shop. You see behind us, we even have some treats. We carry some vitamins and supplements that you may enjoy. So everyone that asked their great questions today, thank you.
Whoa. Okay, it's time to pick the winner. Winner, chicken dinner. $25 gift card.
And the winner is...
The producer tells me that the winner is Brandy Hewlett.
Yay, Brandy.
Scorched Earth Brandy. You're the winner.
Yeah. And Brandy is sharing with us. Yeah. She's struggling to get back to weight after COVID, virtual schooling. The stress is real. Absolutely. And I think we need to give ourselves some grace, because this has been a tough year for a lot of folks. But hopefully that $25 Target gift card makes it a little sweeter.
Hey, Brandy, thanks for tuning in. You've been tuning in for a few weeks. It wasn't just for today.
Thank you so much.
Look, ahead of time, happy Mother's Day to everybody. We won't be here next Monday. To say happy post Mother's Day.
That's right. And we do gift cards. So if you're interested in a Mother's Day gift that maybe would help someone in your life to come in and get help from us, get a gift card. It's a great gift for Mother's Day. So thank you so much for everyone who watched our show today. Jill, email me and I will get that question answered. Yes. We are open in both offices. This has been a wonderful Monday morning AMA.
It's been good.
Yeah.
It's been good. Offices are open. Come see us this week. Have a happy Mother's Day weekend, everybody, and we'll see you in 2 weeks.
Bye, everyone.
Bye.